up here she has these two wrinkles, so that's the wet object in the face today. But then I'll feather just a little bit around, and I use the green to delineate that. And orange to show the limits of placement. And then finally, a little dot just to show where we'll make our entrance sign. For glabellar frown lines, I find that these are very difficult, and the only way to really approach them is first put an intradermal layer over of fat in over the area that I marked in blue, and then to feather a little bit with a sharper cannula, with care not to use anything that's completely sharp due to the possibility of intravascular catastrophes. So just a layer with the sharp needle in the skin, and then going a little bit deeper with a sharper cannula, number 3 for instance, in this area of the green. This is just a little local 0.5% lidocaine with 1 to 200,000 of epinephrine. Could I have a 22 gauge needle with a 1 cc? So on the 3/4 view, you can really see that the different sides. So this side, even though it's shorter, is deeper. So it's going to need a little more. I'm going to use a sharp needle, and you got to be very careful when doing that, just because the possibility of intra-arterial injection is phenomenally high here. And so what I do is I put in little tiny amounts. And this is not withdrawing. This is the opposite of the normal technique I use. This is placing while advancing. So that was just 0.3 cc's. And really take your time here, because a bolus can be devastating. And what you're thinking all the time is you want small aliquots and you don't want to be in a blood vessel. It really is impractical to pull back on the plunger each time. But there, I would say a little more, and then, yeah. And then I'm going to switch to the other side, and I'm going to finish it off with a mini 3. Again, a sharp needle, so you want to be really intradermal or immediately subdermal, but even there, you want to worry all the time about getting into an artery. And try to avoid doing that also, but it's not such a disaster because you're putting it in such small aliquots that it's pretty stable. And again, the blue is the depth of where I'm placing it, so that's really important that you get out. But now I'm going to switch to the 3. So this is a mini 3, and it's spatulated on the end, so I can get in. First of all, I can go through a 22 gauge hole really easily, and then just go right against the skin. So it's sort of hard to overcorrect in this area. It's easy to overcorrect here. And I have had the fat migrate medially, so you need to be careful about overfilling for that reason, is that you don't want it migrating. So that was 0.8 with a 3 mini. I'm just staying right against the skin. And here you want to think the same thing. So all the time is that you just want to put it in little tiny bits, minuscule aliquots. And here I am putting it in as I'm pulling it out. But I'm sort of doing it in a very mini fashion compared to the other areas. And you want to overfill a little bit, but not too much, so I think we're just about where we want to be. So that's on the right side, 0.5 with the mini 3. On the left side, 0.8 with the mini 3. And with a 22 gauge needle, 0.7 on the left and 0.5 on the right. I'm just putting a single stitch right here. I find that a vertical incision here, even though you have the transverse wrinkles, a vertical incision heals much better right above the glabella. So what I'm going to do is I'm going to mark where I'm going to place the fat with a sharp needle using a blue marker, right actually below the white roll. And then the same down here, just showing on the rim. Not on the cutaneous portion, but on the vermilion only. And then I'm not going to put very much because her lower lip is already bigger, a lot bigger. But I want to make sure I maintain a little cleft down the middle, where that orange is. So I'm not going to put much there, but I want to get that sort of flip going here. So it's doing that. And the upper lip, she has 3 sort of tubercles. There's a central one, and she has a nice shape, but just not enough volume. And then over here, where the width of the lip will come from, is the lateral tubercle. And the only incision I make from puncture side will be right outside of the lip. Okay, and then pressure lips. So you can see that there's green, 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 and green. And those are for the sort of balls of the lip. Okay. This is 0.5% lidocaine with 1 to 200,000 of epinephrine. And I'm just putting it into the commissures, not a little bit out on the skin. This is a mini 2, and I'm going to use it to just place the local anesthesia. If I perforate the mucosa, I change cannulas. Okay. Okay, this is a 22 gauge needle, and I'm going to place, okay, here's the cutaneous border here, and then this is where I marked it. So I'm not exactly placing it in the white roll, I'm placing it immediately inferior to the white roll. The white roll does not start at the commissure, it starts a little bit past the commissure. Oops, okay, and obviously staying very superficial, worrying all the time about intra-arterial injections. Put maybe slightly lower level now, but so you can sort of see the needle against the skin. Again, I don't go all the way to the commissure because the white roll doesn't go that far. And looks like I could use a little more over here. Okay. I'm going to place this over along in here, mainly going for trying to avert this area and that area with this very short one. So it was half a cc on that side. Just trying to get aversion. We can finish that off. Okay, so nothing going into the muscle, everything going into the, okay, now the longer one. Everything going immediately subdermal. And here, as we come across, I'm going to get the central portion of the lip going from sort of tubercle to tubercle. I'm getting aversion as well as volume. Go back and get. Her biggest concern is her upper lip. She very specifically said she didn't want her lower lip to be much bigger. So that was 2 cc's, 1/2 cc, 1/2 cc, and 1 cc. You have that mini 3-back and go along first along the rim. Just going for a little bit of a rim there. And now I'm going to go inside. And you can sort of see the fat coming out. So she was not concerned about the lower lip being much bigger, so I'm only going to put 2 cc's in. And so maybe up at 2.5. Let me have a little bit right out here. So I think that's, let me get a little bit more, I'll get it deep back here, just to create more aversion, going really far back on the mucosa. And really you can see it glistening through the mucosa, but it's sort of like advancing the lip. And that, there we go. And then a quick, sometimes I won't close these, but I mainly do it just, if they're going to come back anyway. And it's very alarming for them if it starts oozing later on. I put 1 cc below the white roll to create this roll effect, and then I put 1/2 cc in each lateral upper lip, 1 cc in the central upper lip, and 2 cc's, 2.5 cc's in the lower lip.